So for those of you who don't know me, my name is Kirsty Turnbull and I work for Lynton Lasers, and I have worked for them for about 12 years. So as you can see by the screen, I do training for them, and I tend to do training like level 4s, level 5s, lots of masterclasses, but I also run the Lynton Clinic as well. So I'm currently doing treatments, and I have been doing treatments for about 17 years. So lots of different treatments, but obviously quite a lot on acne as well. And we are going to be sharing this webinar today with a lovely Kerry Belber from Laser Skin Solutions. So do you want to just introduce yourself, Kerry?
Yeah, hi guys. So yeah, my name is Kerry. I own Laser Skin Solutions in Bournemouth, and I've been open for about 15 years. And yeah, I've worked with Lynton all that time. So I started out in 2004, 2005. And yeah, so I've been lasering ever since, particularly doing a lot of acne actually. So yeah, it's really nice to be on the webinar again, and also the other webinars that we've done. Actually, it's lovely to get all your feedback, so thanks for all the messages you've been sending and little video clips that you've been doing and stuff. It's been really good.
Great, good. So like you said, Kerry, you've got a fair amount of experience with acne, and obviously we've been talking the last few days about your personal experiences and, you know, what you found. So we're just going to go through this presentation. It should be about an hour. So we're just going to have a little bit of a look at active acne. So we're going to have a look at sort of, you know, the symptoms of acne. We're going to look at some potential causes of acne, but the list is not exhaustive. And then obviously we're going to look at some treatment options. Obviously, LEDs, IPLs and lasers are one of the main ones we're going to focus on, but we're also going to look at peels as well, and just how we can combine things for best results. So before we get started, just to let you know, there is a Q&A box, so you can post any questions in there that you want to. We're going to keep an eye on that. So please ask away, and then we'll just sort of go through those questions sort of periodically. There's also a chat box as well, so you can have you can put a little message in there. I'm going to primarily focus on the presentation because I've never multitasked before lockdown, but I definitely can't now. But if there's any questions between us, we'll try and answer them. Okay, so we're going to have a look. First of all, let me just go to my slides. So to say what acne is, what the symptoms are, what the medical treatments are that are available. So for example, somebody goes to the GP, what are they recommended? What will the GP normally treat them with? And then also say, obviously we'll look at IPL, we'll look at lasers, and we'll look at LED lights. And then as they finally, we'll look at how we combine that with peels. So just saying here that we always associate really acne with adolescence. So we always sort of think of it as a teenage problem, and you know, you go through it as a teenager, you come out of it and you won't have acne again. Unfortunately, that often isn't the case. And in fact, we are seeing more and more now sort of adult acne. And when we say adult, we don't mean 18 and 19. We mean people in their 30s, and we mean people in their 40s. So I am 37 and I have personally battled acne since I was about 14. Anyone who's met me over years will have seen me at times with clear skin, at times with, you know, a full-blown sort of acne outbreak. And so I've got a lot of personal experience with this, as well as obviously treating my clients. So certainly think about the age of the person. We know that for some people it will just be a single episode. So for example, puberty, pregnancy, moving into menopause. But like me, it can be a long-term problem that unfortunately you can battle pretty much all your adult life, really. We know it can be found on various areas, so face, neck, chest, back, shoulders. These are all places where it's typically found. And we also know that there's different types of lesions as well. So it's not just as simple as spots, there's more to it than that. And unfortunately, there is no proven cure. So it'd be amazing if there was, but at the moment there isn't. I always sort of liken acne very much to eczema or psoriasis, that sort of condition. Obviously, it's not the same. But what I mean by that is, you know, for some people that suffer with eczema and psoriasis, they will grow out of it. Some people will get reoccurring incidences, and it's just about managing it. So managing the symptoms and also managing any factors that may be contributing to it as well. So again, we'll have a look at that.
And also, I was just going to say that from my experience, I get a lot of adults who come in with adult acne. So they'll have had a bout of it, like you did, Kirsty, you know, in their teens. And then they have a long gap of absolutely, you know, perfectly okay skin, no acne. And then suddenly, you know, in their sort of mid to late 20s, it'll erupt. And from my experience, quite often, stress is a big cause of it. And apparently stress can be the sort of the single biggest cause of adult acne. Obviously, there are other things that can affect it, which we'll go on to. But yeah, don't be surprised if you get people in your clinic who haven't had acne for 10 years since they were sort of, you know, 15, 16, and then suddenly now they're presenting with, you know, quite severe acne. So
yeah, absolutely. And I think it comes to a shock to them, doesn't it? If they then develop it later on in life, they sort of, you know, where's this come from? Why on earth now? You know, if they've had it before, it's not such a nasty surprise, but later on in life, it's very much sort of unexpected, isn't it? And
yeah, and I've definitely seen more people who have had that big gap and then they're having acne as adults than, say, people like yourself, who it seems to have been sort of a continuation since their teens. So
yeah, definitely.
And they often say, God, you know, I had this when I was a teenager. I'm not a teenager anymore. You know, why am I getting this? So, so it can be really frustrating for people. So
absolutely. Yeah, I mean, you've hit on, obviously, I'm going to come to this in a second, but you've hit on such an important factor that is stress. And so stress, without a doubt, is one of the big reasons behind acne, we believe. But if you look here, it's sort of saying, well, there's not one reason. It is complicated. Not everybody is the same. A lot of it is down to hormones, and that's not necessarily imbalance. For some people, it is an imbalance. For some people, they've got higher testosterone levels, or they may have lower levels of estrogen, so the testosterone is becoming more dominant. But actually, I think for a lot of clients, certainly ones that have been hormone tested, actually there's nothing wrong with the balance of their hormones at all. It's just simply that they are sensitive to the androgens within the testosterone, and, you know, that is fueling it.
yeah.
It's obvious that we see it, as I said already, you know, adolescence, pregnancy, time of the month, you know, even as we move towards menopause years, hormones are changing, and that's completely understandable. One thing we know is that there's lots of things that can affect our hormones as well. So as you touched on, Kerry, stress is a massive cause or a massive stimulant for a lot of skin problems, actually. So what we know is that when we are under stress, our cortisol levels will rise, the inflammation in our body will rise, and actually also our behaviours change. So all of a sudden, because we're highly stressed, we start going for the junk food, we start reaching maybe for alcohol. Because we're stressed, we're not sleeping properly. And so that whole cycle is obviously very destructive to a skin condition like acne. So stress, certainly. And we will always say to our clients, can you give me, out of 10, how, you know, what are your average stress levels at the moment? You know, give us a bit of an insight into your life. We know then things like medications, so obvious things like the contraceptive pill, the injection, the implant, the Mirena coil, all those things that will affect hormones. We know that steroids, so high doses of steroids, or an obvious one is anabolic steroids. So I've certainly had a couple of bodybuilders in that I think have been on anabolic steroids, which obviously is a contraindication to treatment anyway, but they then develop really nasty, cystic, nodular back acne and shoulder acne and chest. We also know, this one's controversial, and I don't know what you think about this, Kerry, but there's certainly many links suggested towards food. You know, you can read so many articles and sometimes they contradict each other, and sometimes actually it's really confusing. But there's definitely been links to things like dairy, because dairy in itself is from a lactating animal, so it's got lots of hormones in there. Sugar, we know, is another one as well. What were you going to say then, Kerry?
I was going to say that I was reading that what NICE, you know, was saying about the role of diet and acne, and they say it's actually very poorly understood. So there haven't been a lot of sort of clinical trials and studies done on diet. But there have definitely been a lot of observational trials just by, you know, people eliminating things like dairy. I think for a lot of people, dairy is definitely linked to their acne, but there isn't any real concrete evidence to absolutely prove it outright. And what you know, people like Nice are saying, that, you know, on an individual basis, is to try, you know, an elimination diet, obviously with the support of a nutritionist, to try and find out what your triggers are. So although there's not a, you know, 100% link, it, for a lot of people, they just know, you know, I can't have dairy. I mean, I have a friend, and if she sometimes she tries to reintroduce a bit of dairy, and if she has a tiny yogurt pot, she'll erupt, you know, in spots. So she just, you know, she just knows. She doesn't need any clinical trials. You know, she just knows that that is a big trigger for her. So,
and I think you've just hit the nail on the head, actually. Everybody's got to do what they feel is right for them, you know, so
yeah,
whilst we can't prove these things, and I think it depends who you talk to, doesn't it? If you speak to, not to stereotype, but a conventional GP, for example, they tend not to be as convinced by these theories as someone who's maybe more homeopathic or a naturopath, or, you know, tends to focus on that way. I just say to all my clients, look, these are the suggested possibilities. It's up to you to go away and consider them and think about them. I've played around with it over the years, as you can imagine, and I think for me, definitely dairy, without a doubt.
Well, the theory is that it affects the hormonal mediators. That's the thing with dairy, but they just haven't proven it. And that in itself can sort of increase sort of stimulation of an insulin-like growth factor, which is called, I think, IGF-1. And it's not that, oh, if I eat a greasy chip or I'm going to eat that sweet, I'm suddenly going to get a spot. But the role of sort of the impact of, you know, what it has on your blood sugar definitely has an impact on your hormones. And then that in turn can obviously have effect on growth factors. And then as a result, you can get acne. So it's quite a complicated sort of link. But yeah, as you say, if you know it's one of your triggers, it's, you know, it's quite easy to eliminate it. So
yeah, and I think it's how seriously you want to take it. You know, I think, if I'm being honest, some of my clients are very guilty of coming in thinking we've got a magic wand that we can wave, as with most treatments, and, you know, it's down to us to, you know, resolve the acne for them. And I'll just explain that their part is just as important as our part.
yeah.
And in my experience, if they're not looking after themselves, I get a lot of people that come in who are highly stressed, they're not eating properly, they're not sleeping properly, and we've got to tackle that just as much as we've got to treat the symptoms. And unless they're willing to do that, in my experience, results are hit and miss. You know, they've got to look at this holistically, really, and look at the whole approach.
Yeah.
You know, some of it's common sense. Alcohol, we all know alcohol's bad for us. That's an obvious one. And again, some people may not find it's a problem, but also, again, it's associated with, you know, what else is associated with the alcohol? So maybe a sugary cocktail, you know, maybe we're having a few drinks, and then all of a sudden, because we've had a few drinks, we don't sleep well. So then we've got lack of sleep, we've got alcohol, we've got a lot of sugar in our systems. So it's the whole sort of picture, really, isn't it? Yeah. I know certainly for me, lack of sleep is also a problem. So sleep, we know at night time, when you get your sleep, your skin repairs and all sorts of things go on. I don't want to get too complex, but sleep is incredibly important for the health of our skin, for the skin to repair itself. And lack of sleep for a lot of skin problems can be an issue. So I know a few nights ago, I didn't sleep particularly well. And I kid you not, I woke up the next day with probably about 4 or 5 cystic acne spots, sore, inflamed, you know, really not nice. Couple of nights sleep, bright skincare products, no laser at the moment, unfortunately, I haven't got access to one, but, you know, my skin was tons better. So it's not our jobs to give nutritional advice. It's not our jobs to give, you know, counselling and lifestyle advice, although we often do. Just point it out to clients, just make them aware. And lastly, genetics. Genetics is always, you know, blamed for an awful lot of things. And again, as far as I'm aware, there's no proven link, but I think certainly there is a potential genetic link there for a lot of people. Okay, so having a look then sort of anatomically at what's going on. So there's a few things going on actually here. So one thing we know is that if you look at the follicle and you look at everything that's going on with acne, that sebaceous gland which produces the oil in an acne skin is often producing too much, unfortunately. So typically this will end up becoming a really sort of large, almost plug-like structure. For a lot of acne sufferers, they will start to overproduce, so they start to become really oily, really shiny, really greasy. But because oil acts a bit like glue, if that makes sense, it sticks your skin layers down. So I've had people say, I'm really confused because I'm oily, but I'm also dry as well. And what I'll say to them is, you're not dry skinned, you have got dead skin that can't come off because the oil is sticking it down. So we need to look at a way of getting that dead skin off and working on that sort of oil content, working on that sebaceous gland. There's also a lot of inflammation in the area and also a lot of hypersensitivity. So we've got to be careful how we approach this. Whatever methodology you're going to use, we say gentle. So we always use in our clinic progressive, not aggressive. So we don't throw everything at clients to start with. We don't give them lots of things to do. We give them a couple of things to do and then we move on from there. And when it comes to your treatment settings, we'll talk about that shortly, but again, not going in too aggressive. We've got inflammation, we've got sensitivity. You start going in with a lot of heat and potentially you can just exacerbate the problem.
And I think it's important as well as part of the, you know, sort of gaining that client's trust, because the last thing you want if you're going into, you know, I hate being sold to. So, you know, if you're going in with a problem and then a clinic just goes, right, here's our list, there's a big bill at the end of it, you know, it's kind of like, you know, the first time you're seeing them for a consultation, you kind of want to say to them, you know, this is going to be a journey, you know, we'll start you off with this. And I actually actively say to my clients, look, we could do this, this and this, we could do peels, we could do this, we could do all of this stuff, but you might not need all of it. So we'll start with this, we'll monitor you, see how you go. And of course, then we have other options. And then that makes them kind of feel a bit more relaxed as well, that, you know, you're not just going to throw everything at it all at once and they're going to end up with a big bill when maybe they don't need it. So, so it's kind of win-win on that front.
I think you're spot on. I think that's it. Like you say, we try with all our treatments not just to give one option, because we've got to be sensitive to people's budgets. So you get some clients that will come in and they'll spend anything on it because they're desperate, and acne clients often are desperate. You know, they've often, by the time they've come to us, my general experience is they've, you know, sort of exhausted the GP, they've tried lots of things, they're willing to throw money into it. But you've also got clients that are obviously sensitive when it comes to budget. And yeah, I think try something first, see how that goes on, then try something else, and just work your way up essentially. You know, we don't need to throw everything at them.
And also because grade 2 acne, which is actually called acne cosmetica, sometimes it will just respond with a change of cosmetics, and, you know, replacing it with good cosmetics. They may not even need, you know, laser or light treatment. So yeah, it's not always necessary. It depends how they're presenting. So
absolutely, I totally agree. In our clinic, we don't, you know, yes, we are a distributor, you know, of icon lasers, but it doesn't mean that that's always the tool we reach for. We will often look at products first, then peels, and then light is often for us our third option, you know, depending on the problem there. So definitely, yeah. Okay, so let's have a look then. So we've got a bit of an idea of sort of, you know, the anatomy going on there. So we've got different types of lesions, and so you can see here that first picture is, I always love that picture because you just want to go up and squeeze away, but you can see that is your classic blackhead. So your blackhead is just oil that's got trapped in the skin and it's turned black because it's oxidized with the oxygen in the air. We've all got blackheads, and actually, you know, we've all got typically tiny little ones in the side of our nose, maybe corners of your chin and the creases, very normal. But for a real oily acne sufferer, they will notice these particularly. You can then have your closed comedones, so like little white heads, and you can also have uninflamed nodules like cysts. Cysts can be, I find, problematic. I suffer with these, and they can start off as tiny little, almost like the picture shows, tiny little white beads. And in my experience, leave them. Don't mess, don't squeeze, don't touch, because as soon as you do, you start to spread the bacteria, you start to sort of stress everything out, you cause more inflammation, you make something a lot worse. But obviously we all know that that is easier said than done. On the next slide, I know at this point normally I'd be teaching this in a room full of people, and I will normally say who squeezes spots, and at least 3/4 of the room will put their hand up and say, yeah, absolutely. I think we're all human beings, and I think it's hard not to squeeze a spot. But our advice is, if you look at this slide here, you've got papules, which are small red bumps, and you've got your pustules, which are your white yellow heads, and then you've got your inflamed nodules. So what we always say is, with a pustule, you can get a sterile needle, pop it and gently release the pus out, but then you must sterilize afterwards, maybe put on some salicylic acid. Something like a papule or an inflamed nodule, leave it alone. It's full of inflammation. It can be sore sometimes. You are not going to achieve anything by attacking that. In fact, as I say, you'll normally make it worse. So where possible, try not to. And as we all know, it's the squeezing that can then cause scars. So the more squeezing we're doing, the more we're attacking that skin, the more we're going to end up with those ice pick scars that obviously nobody wants.
And also, you sometimes think that when you're squeezing it, you're getting it all out, but actually what you're not realizing is it's all going out underneath, and sometimes the sac in the skin can burst, and then it just becomes a really very messy. So
yeah, it is a tricky one. That I understand why people struggle, but yeah, trying to just get across that we're trying to limit the damage. I mean, if you look at this next slide, you can see that this is someone who's had acne and their skin is healing. And so the first picture just shows lots of red demarcations from where they've had recent outbreaks. And the second picture is more your pigmentation. So we refer to this as hyperpigmentation. Now, what we know is give these people time and their skin will heal. You know, those red marks will go, those pigmented marks will go, but it can take a long time, and it can actually take up to 2 years for these marks to sort themselves out. And in that time, it almost looks like they've still got acne. You know, it's not the way they want their skin to appear. So we'll talk about this shortly, but one thing I always point out at this stage is red marks, we can really help with icon laser. In fact, we've had some fantastic results, really, really good. Pigmented marks, we advise not to treat with an IPL or a laser, just because what you're going to do, obviously, is put in trauma. You're going to put in inflammation. And if you start putting trauma and inflammation into a skin that is already pigmenting, it's going to potentially pigment more. So you're actually going to make those pigmented marks potentially worse. Not guaranteed. I do know some people that use icon lasers for that problem, but we wouldn't recommend it. We prefer skin peels, lightening creams, sort of lightening solutions.
Or LED as well can work really well on that. And also, I would just say, don't forget, guys, that these kind of dark marks can often be quite dermal. So, rather than epidermal. So, IPLing them will the pigment will grab the light, possibly turn darker, but it's just going to make it worse. So,
absolutely, yeah. Scarring, we're not going to talk about scarring today just because the webinar will go on for another hour, and I think people get eventually bored, unfortunately, but we do teach scarring in some of our other courses. And all I'll say at this stage is that with scarring, it's just a case of trying to reduce it as much as you possibly can. So the popular treatments for this condition tend to be, if it's a laser, it tends to be a fractional laser. That could be ablative or non-ablative. You can use fully ablative, it's just quite an aggressive method. Some people will use needle rollers, needle pens or needle stamps. Some people will use mesotherapy. Some people will use a bit of a combination. But one thing I'd just say about scarring is that to really make a difference on scarring, you've got to break down the old sort of necrotic tissue, and you've got to put trauma in to get results. So whereas with active acne, we don't want to put too much trauma in, we want to calm everything down. With acne scarring, we actually want to traumatize the skin on purpose, because by doing that, you will stimulate healing and you will stimulate new growth of collagen, and then you'll start to see your scars starting to smooth out.
I was just going to say, I have the fractional handpiece in clinic, the 2940 wavelength. It is absolutely amazing. I mean, I had a girl who came to me a year ago, and she got married last September, so it's been 2 years ago now. And of course, age plays a part as well. She was 28, but she had far worse scarring than this photo. And literally her skin is just flawless. It is unbelievable. So anyone who is even thinking about wanting to do acne scarring, the fractional skin resurfacing is amazing. I wish I'd had it years ago. It's really, and it changes people's lives. I would say just as much as active acne, acne scarring psychologically really affects people. So because it's like, oh, they've got rid of the acne, but they can never kind of get away from it. They still have the scars left. So so yeah, it's incredible.
Someone's just asked actually in the Q&A, what's the difference between fractional ablative and non-ablative? And so just a quick answer now is just that ablative literally ablates little holes into your epidermis. So you are removing some of the epidermal tissue, and then the heat that you put in, which is typically above 100 degrees Celsius, so it's really hot to cause the ablation, that heat then will spread down into your dermis, and then it will stimulate fibroblasts, which then of course go on to make collagen and go on to make elastin. So with an ablative laser, you are resurfacing and removing some of the top layers of the skin, and you're also working on the deeper layers. With your non-ablative, you are not working on the surface of the skin because you're not ablating, obviously. You're just working on the dermis to stimulate fibroblast sort of activity. So we tend to personally find we get better results with ablative lasers. Kerry's is an ablative. There are different types. There is a 2940, and there is also, which is known as an erbium YAG, and there is also CO2 as well. CO2 is sort of the gold standard for getting amazing results. However, erbium YAG, which is what you're working with, and I use it as well, as like you, we've had some fantastic results. You know, really good.
Years ago, I had a different fractional laser, but it wasn't ablative, and it worked at 1540 nanometers. But honestly, the results were just absolutely, it was nothing like when you're working at 2940 and the target is water and it literally ablates, you know, the surface. It's just incredible. So I think you need to be working at those kind of wavelengths to get those kind of results. And the other thing I was going to say quickly is, you know, I know some clinics do dermapen, and dermapen can be absolutely great. And I don't do it myself, but I've seen some great before and after photos. But what you're not getting with dermapen is the intense heat. And of course, it's the heat that's actually stimulating the process of collagenesis in the skin that's going to give you that amazing plumped up, you know, flawless or pretty flawless skin afterwards. And you just don't get the same with dermapen. You do need that heat in there. So
yeah, and of course with dermapen you don't get the resurfacing either, do you?
No,
You know, it's
exactly.
trauma deep down.
Yeah. Yeah.
So I was just asking on the chat then about using ablative lasers for dark skin types, and what we always advise is that you can use ablative lasers on dark skin types. You've just got to be a little bit more cautious. So you might want to be a little bit more gentle with settings. You might want to wait longer in between. So we tend to do 4 weeks, but you might want to do 6 weeks. You might want to, for example, prep with some lightening creams first. So maybe 2 months before, 6 weeks before, using some products that actually help to inhibit the production of melanin. You would advise, you know, obviously very careful aftercare, SPF, staying out of the sun. But to answer that person's question, yeah, you absolutely can treat. You can potentially treat up to skin type 6. As I say, you've just got to be very careful, and you've got to consider obviously whether they are prone to keloid. And if they are prone to keloid, obviously we wouldn't put any lasers on them at all.
Okay.
But I personally have used ablative lasers on skin types 4 and 5, and had some great results. And actually not had, I can only think of one person where we got pigmentation changes that were really noticeable. So I don't know if you've used them much on dark skin types, Kerry.
I tend not to use, I definitely don't use it past a 4, but I did have a skin type 4 who came in, and I think it's really important, even though I'd really prepped him to say that the patch test, you know, obviously because it draws out, you know, the actual, when you see the marks from the fractional laser, it almost looks like you've been sort of stamped with dark little spots, because obviously the pigment comes out. And he basically just, you know, didn't want his whole face looking like that, which is understandable, even though you tell them it's only for a couple of weeks, etc. But I think you do need to warn people that, you know, it will look worse before it gets better. And also, for some strange reason, it definitely brings out more pigment on the body, I've found. I don't know if you found that, Kirsty.
Yeah,
I know.
yeah.
When I did a scar on I can't do any laser on my face, unfortunately, because I get melasma. But when I did a scar on my body, it was like, I mean, I am half Greek, but regardless, it was chocolate brown. I mean, I could not believe, you know, how dark it was. So just don't assume that if you see that it will be the same on someone's face, because it definitely comes out darker on the body. So
do you patch test, Kerry? Do you tend to
always.
do a little?
Yeah, I never do anything without patch testing, and I never do a patch test without a photo. So first it's photograph, then patch test, then treatment. But yeah, and the other thing is, because of the amount of intense heat. So say someone who comes in, they're, you know, Asian, Indian skin, and you know, that they're a clear type 4, or even depending how dark they are, a type 5. Because obviously they have a lot of melanocytes in their skin, they are going to be releasing more colour, and any kind of hyperpigmentation is an inflammatory response in the skin. Now, because of the amount of heat you're causing with the fractional, I mean, it's just, yeah, so that's why I'm not that keen on doing it. I mean, in Bournemouth, unfortunately, we're not particularly very diverse, you know, ethnically, so we don't naturally get a lot of darker skin types, but I personally wouldn't feel comfortable treating beyond a skin type 4, but that's because, unlike you, I haven't had the experience of treating a 5. But like you say, I think it's incredibly important that they're on something like a Bargi or some kind of, you know, anti-pigmentation cream in the run-up to it, or even a course of LED or something like that before you do treatment.
We'll move on to the next slide. Just quickly before I do, just obviously continue to keep my eye on time. A couple of quick questions about fractional laser. One was, if somebody has got red marks from old acne, would you use IPL first and then fractional laser? My answer to that would be, you can just go on straight to fractional laser if you want to. The fractional laser will work on the redness and the scarring. It will do both. The only time where I might use IPL first personally is if it's, let's say the red marks are really bothering them, the scars are only quite mild, and so I'm thinking, well, you know what, if I get those red marks, you know, pretty much gone, I think they might be happy with that, then I'd do IPL first. Or it might be that, you know, I do some IPL and then just a couple of fractional treatments, you know, we don't need to do as many. So it does depend on the client, but if you've got somebody who's got a lot of redness and scarring, the fractional laser will tackle both. And lastly, a quick question that Ray was asking was, how much would we charge? Don't know how much you charge, Kerry, for your fractional laser treatments. What would you say you were doing half a face?
It depends how, yeah, so for 3/4 of the face, I charge £250 per session. And then if it's full face, it's £295. But I was just going to go back to what you're saying. If I get someone in with those red marks, but they don't have any kind of pitted scarring, it is literally just the red marks after having had acne, I would just do IPL, only because it's full on the fractional laser, you know, and they're very red for several days. The downtime is massive compared to IPL. It's not massive compared to obviously CO2 lasers, but it's nothing like having an IPL treatment. So if it's not necessary and they're quite young and they don't need the collagen stimulation, I would just do the IPL. But if they do have a bit of scarring, then I would do fractional like you would.
Yeah, definitely. Yeah, I think that's good advice. Okay then, so as I say, I didn't want to talk sort of too much about scarring, but I think it is important, and I think a lot of people you know, do want to know more about it. So first of all, we're just having a very quick look at medical treatment. So this is typically somebody goes to the GP and they can obviously recommend various things. So it depends, you know, obviously on the age, whether they're male, whether they're female, and also the severity. So typically a topical solution will be recommended, and they may look at an oral medication as well. I'm careful how I say this, but I think in my experience, quite often with the NHS, it's cost as well. So sometimes they'll go for like the cheapest method. So a cheap topical and maybe a cheap antibiotic or a cheap, you know, contraceptive pill, something like that. And they won't sort of, you know, move you past that until they've been tested. So they tend to have a methodology of try one thing, try it for 3 months. If that's not working, perhaps we'll try something else. But they're not necessarily going to, you know, sort of give you the sort of more expensive options to start with, even if the acne is severe. So I've seen people with bad acne where I've said, I can't treat you, I can only treat mild to moderate, I think you need to see a dermatologist. To get referred to a dermatologist can be very challenging, and you tend to need to have been with a GP for quite some time and exhausted their methods before they'll refer you on. So just to be aware of that, really. Obviously, if you go private, you can see a dermatologist very quickly. So you go to the GP and they can recommend various topical solutions, as we can. So I'm not going to spend too much time on this, but there's various preparations that can be really good. Something as simple as a natural tea tree wash, or I know people use things like aloe vera gel, but equally there's other things like salicylic acid is a very popular one. So I'll touch on that shortly because we use that, and a lot of people do rely upon salicylic acid. Benzoyl peroxide is quite old-fashioned. It's been around for a long time, but it can prove quite effective. It can just make your skin very dry, very sensitive. So you've got to be careful. But I think I'd say that about all acids. All acids, if you overuse them, will make your skin sensitive and potentially dry. Azelaic acid tends to be more of a calming acid out of all of them, and will sort of work on inflammation. And then also you may be prescribed an antibiotic as well. You can get topical antibiotics, and you can of course get oral antibiotics. Some are very effective, you know, some clearly not at all. So this is mainly looking at the topicals, and also considering Retin-A as well. Retin-A is fantastic for most acnes. You've got to be a little bit careful with cystic acne. It can cause a bit more inflammation. You've got to be a little bit cautious how you use it. But Retin-A is fantastic for getting the skin cells to turn over. It's another sort of form of exfoliation, and particularly for an oily, congested acne, it can do very well. I don't know if there's any there, Kerry, that you particularly like to use in your clinic.
Yeah, so I mean, yes, I would agree with everything you've just said already. So I use a mixture of glycolic, salicylic, you know, retinol. It just depends how people are presenting. So
just if you look at this slide, you can see a big red, and so this slide is looking at then more moderate acne. And so typically for moderate acne, they will be put on some form of oral medication as well as topical, or instead of topical, again it varies. But I've put minocycline in red because one thing that we are keen to sort of, you know, get across is what medications are a contraindication to laser and light sources. So for many years, tetracyclines have been a contraindication to laser treatments. So if your clients were on a tetracycline, a limacycline, anything like that, we could not treat them. Now, a few years ago, the BMLA, the British Medical Laser Association, actually said, look, we feel that the risk for those medications is quite low, actually. However, some of them will make you photosensitive. So the advice now is if they are on minocycline, you cannot or should not put a laser onto their skin. It is a contraindication. But if they are on anything else like the tetracycline, the doxycycline, or any of the other antibiotics in that family, it can make them photosensitive. So we would say patch test, and ideally wait a month just to check that the skin is okay. Now, obviously, when you do a patch test on your first treatment, you know, we wait anyway. But the advice is just to wait a little bit longer. And let's say it's, you know, Mrs. Jones and she's treatment number 3, and all of a sudden she's gone on to a tetracycline. You do need to be patch test. So just say minocycline is the only one that is a definite no. So going back to this slide, as I say, various antibiotics can be a solution. The problem for me with antibiotics are, if like me, you're suffering with acne all your adult life, antibiotics are not a great option because you should not be on antibiotics for 20 years. I know some people who have been, but eventually you'll become resistant to them, and the acne won't respond anyway. And it's not an effective way, I believe, in treating acne in the long term. These are more for people who've got maybe a short outbreak, or they're at a point where they just have had enough and they just need something just to sort of, you know, get in there and work on it.
yeah, especially because, especially with Roaccutane, it's just really not a nice antibiotic. I mean, it absolutely has its place. You know, I have twin brothers who had terrible acne in their teens, and they had one course of Roaccutane, and yes, their skin was horribly dry, etc., but it absolutely hit it on the head. But I've had clients who've come in who've been on Roaccutane, and when they stop, it, you know, it comes back. And the side effects are, you know, are really not great. I mean, I was reading them recently, and apart from the obvious ones, you know, mood, and it's even been linked to suicide, but it's even linked to acute schizophrenia. I mean, like, so, you know, you'd only really consider something like that. I mean, I would, you know, but then of course we have to realize that for some people it's obviously the option of either paying for a prescription or paying for, and not everyone is able to have, you know, laser treatment. So it's you know, it depends on people's ability to what their options are. But it's definitely not something I would go into lightly, Roaccutane. And I think the more informed you are as, you know, clinicians about Roaccutane, so if people are coming to you for consultation and trying to decide what to do without obviously, you know, frightening them, just lay out, you know, what the score is with this antibiotic.
Yeah, I mean, you've hit on a really controversial point actually, which is Roaccutane. And so you can see by slide, ideally Roaccutane is more for a moderate to severe acne, but I know people who've had quite mild acne and actually they've been prescribed Roaccutane. And you can be prescribed different dosages. So for a mild acne, you can obviously have a very, you know, low amount. And as you can see by these pictures here, it can be fantastic. It honestly can be amazing. The results from Roaccutane can be, you know, just amazing. I've personally seen some great results. So I'm in one way an advocate of it. However, I'm very much with Kerry. You've really got to think about the side effects. So, you know, there's a list that will come up in a second about the side effects, but already Kerry's listed some of them, the sort of psychological impacts it can have. It can have, you know, brain fog, for example. You will generally get dry skin. That's almost a given, because what Roaccutane does is basically shrinks the sebaceous gland and stops you from producing anywhere near as much sebum as you would normally. So you often end up with dry skin. It can be a dermatitis. It can be very dry. It can be sore eyeballs because they're dry. Nasal passages can really dry up. Lips can become very cracked. So it's certainly, you know, a serious drug. When I spoke to a dermatologist that we work with, and Kerry and I were reading an article yesterday as well, you know, there was some great press about it. But again, as Kerry's pointed out, it's not necessarily a one-trick pony. So I think the problem with Roaccutane is people assume that all you need is one course and that's it, you're cured. As you can see by this slide, it's saying that, and these are averages, I've read a few different articles, I've tried to average it, but about 50 to 60% that go on to Roaccutane will only need one course, and that course tends to be 3 to 6 months, and their acne will not return. Now, that doesn't mean that they're not going to get a spot, but they're not going to get a full-blown acne outbreak. However, that of course then leaves another 40 to 50% of people where they get acne again, and they need to go on it another, you know, 2, 3, 4 times, to the point where in the end actually it's not been successful for them. So I think, as I say, it's controversial. I'm going to be careful what I say about it. For me personally, I think there is a place for it. I think for moderate to severe acne, the results from it can be amazing, but you've got to be aware of the side effects, and you've got to be aware, you've got to be prepared to go through it really.
I think for me, because possibly 50% of people are not going to respond anyway, and because I've seen the kind of results you can get using, you know, laser and light treatments, for me it's just, you know, a no-brainer. I wouldn't want to take a medication like that. But also what you were saying about brain fog, I was reading recently that apparently they won't prescribe it to adolescents who are nearing exams, because it is literally that it affects your brain that much, of being able to concentrate and retain information. So yeah.
Well, that's why I've never gone on it, because my brain's not the sharpest at the best of times. So
I was thinking recently, with my lack of sleep with my 4-year-old, I wouldn't be able to cope with Roaccutane as well. So.
Okay, so moving on then, just quickly, I know I spotted somebody asked a question about topical retin-A, is it prescription only? It depends on the percentage basically. So I am a beauty therapist, I'm not medical, and I you know, will sell people products with retin-A in there, but the percentage is very minimal and actually tends to be retinol, which is a weaker form. So certainly as you get into the stronger percentages, then yes, it should be prescribed and used cautiously. So looking at, this is the bit that I suspect a lot of people are really interested in. How does light work on acne? And does it always work? So this is saying that, well, a lot of people have sort of realised that UV exposure actually can really help acne. So I know when I was a teenager, I used to go on the sunbed quite a lot because it really helped my acne, and I got a great tan as well, win-win. But as we know, it's not a win-win. You know, I've now got sun damage and skin damage from those years that you can see under a UV camera. So in our opinion, it's not worth the damage that you will cause later years to be recommending this as an option, and I don't think anyone does recommend this now as an option. Obviously the sun's a problem with lasers and IPLs anyway. So have a look at light. We've got different colours, as you'll all know, we've got different wavelengths, and they all have different interactions with the skin. So one thing we know is that blue light is particularly good at killing P. acnes bacteria, and there's actually a C bacteria as well now that I know has been talked about in the last couple of years.
Yeah, it's called QT bacterium, because it was always called P. acnes, propionium bacterium, but it tends to be referred to in journals now more as C. acnes, which is QT bacterium. So QT basically meaning skin, I guess. So
yeah, I mean, it's certainly well, certainly a good amount of bacteria that's present in that skin, and the levels are elevated. And what we know is that there are porphyrins in the bacteria that are really good at absorbing blue light. So blue light or even a green light actually can be quite good, and they'll absorb it, and then what they will do is they will release single oxygen, and that oxygen will go on to smother and kill that bacteria. So for years now we've known this. The only problem with blue light is, whilst it's great at killing bacteria, it's a short wavelength. It tends to be around 400 to 500 nanometers or thereabouts, and so it can't penetrate into the skin that deeply. So I know before my time, when Lynton were looking into this, they started to look into green and yellow light. So a little bit further along, more like your 585 type wavelengths, which a lot of you will be familiar with because you'll work with them. And what they learned was not only was that really successful at killing bacteria, it also got into the skin slightly a better, deeper penetration. And therefore, if we can get into the skin a little bit deeper, we can start to have other effects as well. So what we learned is that red and infrared light, so longer wavelengths and more 600s all the way up to 1000, 1100, all of those wavelengths will not only get deeper, obviously, but also they have other effects. So they will reduce the inflammation in the skin and within that spot or that cyst. And they will also look to reduce the size of the sebaceous gland, so reducing it back down to a more normal size. One thing that I personally have always noticed is that if I do have an inflamed spot and I treat it, let's say that evening after clinic, with an IPL or a laser device, honestly, the next day my spots can be 50% smaller. Provided I've had an okay night's sleep, it can make a really good difference. But you then just got to then keep at it, because the inflammation, of course, can increase again. But that's what we're working on. That's what we're trying to achieve. We're trying to kill the bacteria, we're trying to reduce the inflammation, and we're trying to reduce the size of the sebaceous gland and also just promote healing. So whilst these wavelengths that I'm just going to talk about now, we don't recommend using them for acne scarring because they're just not strong enough. They will help a very new scar, or they will help a very mild one. And so again, it's all about the healing as well. So you can see here the common wavelengths that tend to be used. So for IPL, for acne, tends to be 500 to about 595. We use 585. Pulse dye lasers tend to range about 570, 595. LED lights, which we'll touch on, and I'll get you to talk about those, Kerry, because you really like LED lights, don't you?
Yes, I do. Sorry, you're going to go on to the next one.
I'll do this and then we'll come to LED lights. So LED lights, you can have a range of wavelengths, and you can also emit those wavelengths at the same time. So at the same time, you can have blue, you can have red, you can have infrared, depending on the type of device you've got, obviously. And then lastly, to be totally honest, I only learned this for myself a few years ago, and it was Sam Hills that dropped it into a conversation, and it was that a long pulsed ND YAG 1064 can also be quite effective. There's some really nice papers on this wavelength being used, and we think it's primarily for reducing the inflammation and promoting healing. It's not the right wavelength technically to kill bacteria, but I suspect if you get enough heat in there, you will get some destruction of bacteria as well. So it's not something that we necessarily teach when somebody buys a long pulse ND YAG from us. We don't believe it's the best tool, but if you've got one, it's worth being aware that it does have some uses for an active acne. So LED lights. So yeah, tell us what are your experiences with LED lights, Kerry?
So it's funny, so my treatment of choice, hands down, for active acne is your Lumina 585 handpiece. And the reason for that is because the treatment protocol that I do and follow is basically you do a glycolic peel 1 week, then a laser the next, and and so on. So you're interspersing it, 1 week peel, 1 week laser, 1 week peel, 1 week laser. Although now you've obviously brought out the triacid peel, so you can actually do that before a laser treatment. But whereas the LED, you really need to get someone under it, ideally 2 to possibly 3 times a week, to lie under it for 20 minutes. Whereas the 585 handpiece is just a lot quicker. Now, my experience with treating using LED was because I wasn't using my Lumina, because they were presenting with pigmentation. Now, there was a thought that possibly blue light wasn't very good for pigmentation, although the LED system I use, they have now issued a paper saying actually it's yellow light that's worse for pigmentation. So anyone who was coming in with acne, I was actually only using the red and near infrared light, and I was getting amazing results. So even though I wasn't using a blue light that obviously in theory is going to be killing the bacteria, this anaerobic bacteria that's on the skin, I was getting great results by just using red and near infrared. But my ideal would be to do a glycolic peel and a laser treatment. I just think the results are quicker and probably better. So
yeah, I'd agree with you. I mean, you've got more experience than I have with LED lights. I think you can see by this slide here, there are advantages to LED lights. And I think those advantages are things like, it doesn't matter if someone's tanned.
yeah.
So with tanned, you can still put them under. It doesn't matter what skin type they are. It's also very relaxing. So you essentially lie under the canopy that you saw in the previous picture for at least 10 minutes, but ideally it's 15 to 20 minutes. So it's a nice procedure for clients. But as Kerry said, really for best results, it needs to be coming in twice a week with 48 hours in between, and 3 times a week is even better. So it's just who can commit to that. Obviously, that can be a problem when we're generally, quite time constricted. The other good points are there's no downtime, and there's no risks with LED. You cannot burn someone, you cannot cause any problems on the skin. So I think ultimately you've got to decide what's best for your clinic, obviously.
Yeah,
if I show you some of the pictures here, you can see that this one is a very mild acne, very mild indeed, but you can see he's responded quite nicely. So he's had 8 treatments, and 12 weeks from the end of treatment, you can see that his skin is almost clear. And I suppose for somebody like this, because obviously he's also going to have thick, dark beard hair, if you start firing an IPL onto that beard hair, you're going to start killing it. And that, for this particular person, could be a problem. So you've got to think about things like that as well. If I use an IPL, I might kill some hair. He might not be happy with that. So I'm going to use an LED light instead.
And also LEDs are an absolute lifesaver for your skin type, Fitzpatrick skin type 6, because obviously you can't laser them. So not with an IPL anyway. So yeah, so it's just basically having that kind of your options available to treat anyone who comes through the door, really.
Definitely. Just showing some more there. You can see someone there who's had cystic acne. What always impresses me with this picture is, or what I noticed is that obviously the acne's gone and it's amazing actually the results. But you can just see she's now got some ice pick scarring. So that's the sort of thing then we'd use with the fractional laser and go on to work on that. It's worth just pointing out that with fractional laser, we do sort of state that you shouldn't have any active acne in the area. So 1 or 2 spots is okay, but if someone's got active acne and you start treating them with a fractional laser, you're probably going to make the active acne a lot worse because you're putting in so much trauma. So choose the right time to use those devices, really. This picture I like because it's not, let's be honest, it's not, wow, that's amazing, what a difference, but there is some difference. But that's realistic. It's going to take time. It's not a miracle. You're not curing the acne. As we said before, she's got to consider lifestyle. And as you mentioned, Kerry, for darker skin types, this person is still probably only skin type 3 or 4, but with IPL, we do need to be more cautious. And we don't really recommend using the 585 on anyone who's darker than skin type 4. Certainly not for acne anyway. Depends what treatment you're doing. If you're doing vessels, we actually limit you more. We say skin type 3. So as we start getting into those darker Asian skin types, IPL is not really an option anymore.
No, and I would say that for her, although as us looking at as clinicians at a before and after, but for her it was probably a big deal because, you know, even if you have a few spots and they keep coming back all the time, it's just, you know, it's just really annoying. So I bet she was really pleased with that.
Yeah, and I think, you know, I think as an acne sufferer myself, you get to accept that you're probably always going to have a couple of spots. You get used to it, you know, it's just the norm. You know, I don't think I'm ever spot free. But if you've only got 2 or 3 lingering, that's far better than having 10 or 11. You know, it makes a big difference. And as we know, it's always about reduction. It's never about removal, unfortunately. So having a look at IPL then. So Kerry said already it's her preferred tool. I totally agree, it is mine as well. So what we know is that we would recommend typically 4 to 6 treatments. Any less than that, I don't think is worth bothering, unless maybe they've just got 1 or 2 spots and, you know, a couple of treatments will be sufficient. So we say 4 to 6 treatments, and we say every 2 to 3 weeks. So there is commitment needed, but most clients are happy to come in every 2 weeks. They can manage it and they want to work on their acne. You can see here that I've just put settings. It depends on what you're treating. So if you are treating an active acne and there's inflammation in there, be careful, as I said earlier. So keep your settings lower. You'll have it on your parameter charts, but just to give you a little bit of an example, a skin type 2, we might be using something like an 18 joules, you know, a 3 pulse and a 30 delay. That's just to give you a bit of a ballpark sort of idea. But what we will do is we'll always pass twice because we want to get the light in. We just don't want to get too much heat in. If somebody's got then an old acne and it's red marks and not pigmented, because obviously we don't want to use IPL or a laser on those, but they've got the red marks, we will still pass twice, but we will do the opposite. We'll go high. We'll go as high as obviously we can within, you know, tolerability and also the parameters. So obviously make sure we patch test that, you know, you're testing this first. The concept with the red marks is you actually want to cause some trauma and you want to cause some healing. And sometimes you get people that have got a bit of a mixture. So they've got some active and some red marks. That's normally me. So what I would do is on that second pass, I've just altered my settings. Active acne, I'd go on with the low settings. You know, the marks, I'd go on with the higher settings. And that's where your small block really comes in useful. You know, that's a brilliant thing about the Lynton equipment. You know, you could just cherry pick out what you need to. So if it's one thing, pass twice on the same settings, but if you've got a bit of a mixture, you can just think about alternating settings. Just again, make sure you find out what those settings are on your patch test. Don't be going too high or higher than doing your test. We talked about skin type suitability, so we said up to a light Asian skin type. Obviously, as we know, people must not be tanned. It's really important. So one thing when we reopen our clinic is that we are checking with everybody that they are not tanned because the weather has been nice recently. And lastly, and this is the same for every treatment that you will do for acne, they need to think about maintenance. So be it LED lights, be it IPL, maintenance probably will be required. Time will tell with this, you know, we have to wait and see. Tell me a bit about your results, Kerry. You were saying the other day to me about, because we were talking about maintenance, weren't we?
Yeah. So I generally, people come in, they have a course and it pretty much sorts it. Obviously, they do have to come back in for the odd. It might be, you know, once every couple of months. It might be once every 6 months. I mean, one of the guys I treated, which I think's on the Lynton manual, and might even be on here actually. I treated him in like 2006. I've never seen him since. And I actually emailed him about a year ago, and you know, he's now living in Dubai and he's been completely spot free ever since. So although I don't promise sort of it's a cure, you know, I do generally get really good results. And I think once you put them on really good skincare as well, and you get them back in, you know, I say to them, because sometimes they say, oh, well, should I wait until it gets really bad? I say, no, if you feel like you're starting to break out, come back in and have a quick shot of the laser. So that's definitely, but I find the best results I get is to intersperse it with glycolic peels, because just remember, guys, that when you have acneic skin, you've got something called keratosis hypertension, which was on one of Kirsty's earlier slides. So the skin is kind of holding on to dead skin, and it's on the surface and lining the follicle as well. And of course that's giving more sort of food to the kind of the anaerobic bacteria, which love conditions where there's no oxygen. So you've got lovely loads of thick skin cells. You also have your sebum becomes stickier because it has less linoleic acid in it, and so the bacteria go into overdrive. So by removing the skin, not only are you helping to oxygenate, which is going to help, you know, kill off bacteria, but then it allows the light to penetrate that much better. So one of my before and after photos that I use on my website, I mean, he would have hands down needed 6 treatments if he hadn't have had, you know, it interspersed with glycolic peels. So the fact that he had peels got results much quicker. And obviously using a glycolic at home helps as well. So yeah.
Yeah, I mean, we'll have a look at those slides shortly. Actually, the chat you're referring to will come up soon, so I can show you those pictures that Kerry's talking about. But I totally agree with her. I think the combination, you know, generally always gets best results. This slide I just wanted to point out is someone who I'm not even convinced they've got acne as such, they've just got a few breakouts, but it is those old red marks that I was referring to. Somebody just asked if I can give example of settings. Again, I'm always cautious about doing this, but you know, for me, a skin type like that, like a 1 or 2, I'm going to want to be more in my vascular type settings. So I'm going to want to be more 22, 24, 26, 2 pulses, 20 delay. I'll normally do it in my small block, so I'm literally just targeting that area. One thing that is worth pointing out is that we always say wherever there is acne, treat the whole area. So don't just get your small block out and just treat each little spot. You know, get the medium block out, treat the whole area, go a little bit further than you need to because bacteria does spread. So really treat the whole area. And then if you're not changing your settings, you can just go back over again with a medium block. If you're thinking about changing your settings because you've got a bit of active and you've got a bit of old, then you could cherry pick with your small block. And of course, as you're increasing those settings, it becomes safer to use a small block. So yeah, certainly 22, 24, 26 for skin type 1 or 2 is a good sort of ballpark figure really for people. One thing then, just to say, I'm just conscious of time, so I do want to push on, but somebody just asked about pricing. I don't know how much you charge for full face of IPL, Kerry. What would you, obviously, like you say, you often combine it with peels, but what would you typically charge?
Yeah, so I charge between $220 and $240 for full face. But if it's like nose and cheeks, I'd charge $160. But for me, cheeks doesn't include the jawline. That, you know, really is your cheek here under the sort of, you know, the zygomatic bone. So yeah, $160 to do that. Sort of $220 to do all of this, sort of 3/4 of the face, and then $240 if I'm doing the forehead as well.
You've got, I mean, pricing is always an interesting conversation. You've got to find what's right for you based on your location, you know, what the sort of economic state is where you live, what competitors you've got. Although I think you don't price against competition, in my opinion. You price against what's right for you, for your clinic.
Yeah,
it's not about trying to be.
Yeah, I don't.
You don't get into prices. Yeah, you've got to think about what works for you and what works for your clinic. We're quite sensible with our prices for our IPL with acne, just because we find if they're too high, people don't always pay them for acne. But that's just a bit of a generalisation. I think, Kerry, your pricing is good and it is right. So then, looking at combining treatments, obviously we talked about it quite a bit. You know, I don't know if anyone's aware, but we have a tri-fruit acid peel that we launched probably a couple of years ago now. I lose track of time, maybe a year ago, and I know some of you have got it. And we launched this peel because basically there's lots of good peels out there. We're not trying to compete with them. There's many good peels out there. But what we wanted was a peel that we could use potentially on the same day as using something like an IPL, because that's something that we've been asked quite a lot and we know it enhances results. So this is why we brought this peel out. So before we have a look at our peel, just touching then to say, as we said already, combinations of treatments work far better. So peels obviously will remove that top layer of the skin. It'll get off that stratum corneum that's stuck. It will get off that horny sort of layer that needs to come off. So, you know, a peel on its own will make your skin look a little bit smoother, but also then it allows the IPL or the LED light to penetrate deeper and get better results. And peels on their own, as we both said, can have some nice results without light. Peels are not just exfoliating, they unclog pores, they get into that pore and clean. And they're also, some of them, very anti-inflammatory as well, particularly something like a salicylic or a lactic. They're known to be anti-inflammatory and calming. So peels just on their own can get some lovely results. So just a really quick look then at some of the results that have been achieved by various people over the years with, you can see here, this LED light. So LED lights, about 8 treatments with 3 to 4 peels. This one is amazing. The results here on this are really excellent, really good results. So again, these are people that are potentially peeling on the same day. This is your chap then, isn't it, Kerry?
Yeah. And it's funny what you were saying before about, you know, getting your client to work with you. I mean, he, bless him, his parents, well, he was early 20s, he was at uni, but his parents were paying for it. He thought it was a complete load of rubbish. He was kind of sitting there giving it all the kind of attitude of, you know, I don't really want to be here kind of thing. And bless him, he really worked with me. He did exactly what I asked him in terms of looking at his diet, even though obviously I'm not a nutritionist, etc. But all the kind of basic information you give out in terms of taking the whole holistic approach. And, you know, he got the results and, you know, he was absolutely chuffed to bits. But it's interesting to note, though, if you look at the date on these pictures, he finished, because I was interspersing peels with laser, he started in January, but he finished sort of mid-April. But that photo I've taken is in September. His skin didn't look like the photo on the right at mid-April when he just finished his course. So the benefits of IPL in terms of the collagenesis that you get go on for quite a few months post-treatment. And so I take pictures all along, but when I do my final treatment, any kind of skin treatments, I actually allow about sort of 4 to 6 months post and get them to come back in for a photograph, because then I think you get the true picture of just the extent of the work that you've managed to do for them.
Yeah, absolutely. Yeah, definitely. I mean, that the results there are fantastic, and I think exactly like you just said, Kerry, it takes time. So we know that most of what we do is not instant. You know, vessels can be instant, but the majority of what we do takes place over time, and it's the same with acne clients. They're looking for a quick resolution, but unfortunately that's typically not possible. So always encourage your clients to come in 2 to 3 months later to get final pictures, and also, you know, maybe another treatment. You know, for me, I've noticed that some of my clients do need maintenance, which I'll touch on. I need maintenance. You know, if we don't keep on with these treatments, the acne will start to come back. So by getting the clients come in 2 months later and say, look, just come in 2 months time, have a peel and an IPL, or have just a peel, or have a peel and LED light, but also I want to get photographs and I want to have a look at your skin as well. Okay, so good pictures there. So as I say, this peel was, you know, devised, as I say, for the reasons that it was. And so you can see it's a 20% peel. It's got a pH level of 3. And you can see it's a mixture of acids there. So AHA and BHA. So you've got glycolic, you've got malic, you've got salicylic, and you've got tartaric as well. I just want to point out that whilst we're saying it can be used safely on the same day as IPL, you've still got to be incredibly careful. There is a protocol for this. So we don't, for example, put the peel on for 10 minutes and then start, you know, firing away with the IPL. Or, you know, we're careful about how we approach it. So the first peel will typically only be left on for 3 minutes, and then we'll go up from there. And again, it's up to you how you do it. You know, our protocol is to do it on the same day, but some people will peel first and then, like you're saying, Kerry, a week or 2 later get them back. Particularly with stronger peels, you need to do that. You can't do it on the same day. But also, for very congested, thickened, oily acne, doing 2 or 3 peels before you even look at light is quite a good place to start, to get all that old horny skin off before you start putting the light on. So it might be that you do sort of 3 peels before you even touch your IPL machine. So just touching on the acids, again, I don't want to spend too long on it. I'm conscious we're running out of time. But if we look at what the different acids are, I've sort of said it already. Salicylic acid typically comes from willow bark, anti-inflammatory as well as exfoliating. I love salicylic acid. I think it's fantastic. Brilliant for acne. I personally love it. Also, the great thing about salicylic acid is it will get deeper, so it will really get into the pore and it will really deep clean. Glycolic tends to be really good for the outer layer of your skin, so it will really help to exfoliate that top layer, and it will also help to promote cell renewal. Glycolic typically is derived from sugarcane, but it does vary. And then malic acid is one that I wasn't as familiar with, in truth. I haven't come across it as much, but it's found in apples, and it's used to balance pH levels and also help with moisture retention as well. So it's a good sort of all-round type peel. And for some of you, again, I know you're aware, I know some of you, I've sort of done some training with you already on this when you've been to a clinical update. But just to give you a little bit of an idea of, we came up with a protocol called the Illumifacial. And we tend to market it mainly at rejuvenation, you know, so sun damage or collagen stimulation, but it's also a really good protocol for acne as well. So a quick overview is that it's a cleanse with our Lynton cleanser. We then put the peel on, and say anything from 3 to 10 minutes. We will then perform our IPL. We will then put a thick layer of light soothe on and use it as a mask. And then finally, we'll put on some stem cell serum and some light protect as well. So to say, whilst we market that as a rejuvenation treatment, it's also a great one for active acne also.
One of the things, having only recently started using the Triactive, I've always used a different glycolic peel, is the consistency of it. It's quite thick, and that's nice because sometimes they can be a bit runny, and obviously, you know, you don't want to be getting it into people's eyes. So I really like that it's actually a little bit thicker than what I've been used to using, so it goes on really nicely.
A nice peel, it honestly is.
Yeah.
It took a while to develop it. They wanted to get it right, and it's a nice all-rounder, you know. So it's not, we're aware there's different peels out there. We're aware that there's some peels for pigmentation, there's some peels for acne, you know. It's just a good all-rounder. But it's a nice peel.
It really works, because when I used it last week, I had the tiniest little bump. It wasn't even a spot there, and I just went over it, because you know what you do to yourself is not what you do to your clients. And it literally came up for about, you know, it was just wide open after that. And I had some light treatments, that was fine. But yeah, so really don't go over even the tiniest of little breakages in skin, because then you really see how it works.
We always joke that, and Sam Hills might be listening to this, but I'll say it anyway. We always joke that Sam Hills isn't great with skincare, you know, because she's not. And so she put the peel on thinking, there's not much in it. It's not going to do a lot, you know, I'll just whack it on, you know, leave it on for a few minutes. And she got real dryness around her mouth area.
Yeah.
You know, she probably left it on for probably a little bit too long. She's a Caucasian, you know, slightly sensitive skin. And so it proves that, yeah, it's got potency, you know.
It's hilarious what we do to ourselves, though, isn't it? We wouldn't do it to clients, but we do it to ourselves.
How we test things, isn't it? Yeah. Try it on ourselves first, and yeah, absolutely. Okay, then, so last couple of slides. I apologise because I know we're running slightly over than what I said, but obviously we started slightly late as well. So I've just reiterated here that, I mean, for me, I do talk about maintenance because I do find that clients need to be thinking about it. But that's the same with everything, isn't it? You know, what is permanent? Rosacea will probably return, you know, pigmentation eventually will return. You know, this is the same with most of our treatments. For me, I have to say, I find that people are not great at maintenance unless it's collagen stimulation. People seem to be really good at coming in when they've got a problem, and then you won't see them again until that problem's really bad again. But as Kerry was saying, don't let it get bad. You know, don't let your acne get to that point where, you know, you're almost back to square one again. You know, come in regularly. I mean, I'm saying there every 4 to 6 weeks would be amazing. Some clients will not do that, and I appreciate they won't do it. But if you can just get them in every 2 months, every 3 months, you know, and it doesn't have to be IPL. It could be a peel one time, and then the next time it could be, you know, a peel and IPL. But if they are going to be suffering from a long, you know, sort of term acne, they need to get into heads that they need to maintain. And also, as a great side effect of the IPL, you're stimulating collagen. So from my point of view, 37 with acne is pants, to be honest. But at the same time as doing my treatments, I'm getting collagen stimulation, you know, and I'm looking after my skin from an aging point of view as well. So I think just reiterate that, as Kerry was saying, reiterate home care, reiterate products. Obviously, we've not gone into that today because that's not really quite what we're about. But, you know, reiterate the whole sort of, you know, package concept. So to summarise, come up with a plan, decide what that plan is, maybe have 2 plans, you know, it doesn't have to be one fixed concept, come up with a couple that are different costings, We would advise that you only tackle mild to moderate acne. Anything more than that, I would refer on. I don't think it's worth you spending your time or the client spending their money. I don't think they'll get good results. Talk about lifestyle, talk about everything that's involved in there. Talk about the concept of there will be improvement, but results vary. So I can honestly say I've had a couple of clients that have not really had great results, and they weren't unhappy because I explained it to them in a consultation. So in a consultation, I said, look, your results may be very minimal. We've just got to see how this goes. Let's take pictures and let's see how we go with that. Trying to meet client expectations is incredibly hard, as we all know. And also there is no cure, as I said at the beginning. It is long-term management, really. So anything else you want to add into that, Kerry?
I was just going to say that when we talk about mild to moderate, on something like what's called the Leeds grading system of 1 to 4, grade 3 is acne vulgaris, and we're definitely saying to treat that. Someone who walks in with acne vulgaris, it can look quite severe, but it obviously is probably still sort of moderate. But I would definitely tackle that. The things that don't respond, I've only ever had one client who's not responded with the Lumina, and she had hormonal acne. She was between pregnancies. She always erupts when she's pregnant, and even though she was planning to have another child, she just did not want to wait. And I said to her, look, I just don't know how it's going to respond because we're dealing with sort of hormonal acne, and it didn't. But she's the only person who's not responded. The other thing I would add is that cystic acne, because it's quite deep, you just don't get great results with cystic acne. I always think, it's worth a go, because quite often when they have cystic, they also have acne vulgaris as well, quite often. So grade 3 acne anyway, so you might as well try. But if they were only coming in with big cysts, yeah, if they wanted to give it a go, but I would err on the side of caution. But the last thing I would say is, if people say, well, does this really work, etc., etc., if you want to give them a little bit of background, it was first pioneered by a doctor. I don't know if it's Dr. Chu or Dr. Shu, but it's CHU.
All right, well, I know, I always said Chu, but
yeah, I'm not sure. But anyway, Dr. Chu. But yeah, he pioneered this, about 20, I think it was about 20 years ago now, wasn't it? And he,
yeah, it would be,
at the Imperial College London, and he literally got a load of people, told them, all acne sufferers, told them all they were going to get this amazing light treatment, but half of them got a dummy light and half of them were treated with laser. And so he was testing for placebo. So the ones who didn't receive the actual laser light did not respond. And so we've known for quite some time that, you do get good results, but because it's quite a complicated condition, we always have to say to people, look, yes, in trials it works. You can show them your own photos or Lynton photos, but you have to prepare them for the fact that they may not get the results that, that they want. So
yeah, definitely. Okay, so I'm just scrolling through the questions in the chat. There's quite a bit here, actually, so I'm not going to be able to go through all of them, but a couple of things. Well, a couple of people have asked about the slides. You can certainly have the slides, that's no problem, so we'll email those out to anyone that has attended today. And then also, I'm just trying to pick out some sort of, I think what are good and hopefully relevant questions. So, well, first of all, is where can I purchase the peel? Well, the Triactive peel is us, so you can contact us and purchase it. I don't know the price off the top of my head, if I'm being honest, but you can get that easily through us. Something else is asking about products. We have a small range of products, as you probably know, that are great for pre and post laser treatments, to keeping the skin sort of in good condition. But also we do use another range as well, because we do need to treat people with specific problems like acne, pigmentation. So we use Image skincare in our clinic, and we've used it for nearly a year now, actually. We love it, genuinely love it. I don't know, what do you use in your clinic, Kerry?
I use Jan Marini, yeah, I love those products, but I am going to start to look at other things as well, but historically I've always treated people with Jan Marini.
There's so many good ranges around, there really are, and we get asked all the time what we'd recommend, and I'm always sort of mindful of what I say, but we certainly did, my colleague Emma did a lot of research on this when we were looking at products, and we looked at various ones, and we went for Image personally because it ticked lots of boxes for us. So, you know, it used lots of really good ingredients, but they also smell really nice, which I think for some people is important. It shouldn't be the main thing. They're pleasant to use, and the costing is not too high. I mean, a good cosmeceutical is not cheap, unfortunately. But yeah, I mean, Jamarine is another good one as well.
Yeah.
Somebody's asking here, sorry, Kerry, you.
I was just going to say, someone's saying, how do you manage client expectations? I really take it personally when someone comes back after a week or so and says it's getting worse, not clearing up as quickly as they'd like, and they're getting upset after being so positive following consultation. I take it to heart, and that's made me wary and cautious, do not want to deal as much with acne. So first of all, I would say, I always tell my clients, if they are going to be using a glycolic product, glycolic has a purging effect on the skin. So they need to expect it to dry. So I would say to them, look, it's not going to give you spots, but it is going to draw out all the impurities. So rather than getting a spot here and a spot there, you might experience a full-on, you know, sort of breakout. But that's not necessarily a bad thing. But I think with clients like that, it's important to make sure to prepare them for the fact that it might get worse before it gets better, and to keep going with it. As I say, I mean, I don't know if it's very helpful, but I've never had anyone who's not responded apart from this hormonally sort of induced acne. So I hope that gives you confidence, because I can honestly say I love treating acne. It's, you know, I had a brother who sadly passed away years ago, and he had terrible acne, and I only wish that I had something like, you know, the Lumina then, because it would just completely changed a lot of things for him. And I think, you know, the psychological impact it has on people, they have to understand they're going to come to you feeling pretty down about it anyway, and then if they feel leaving really happy but then it gets worse, that's normal. So if you prep them for that, almost tell them to expect it, that it might happen, but to keep going. They have to be committed to run the marathon basically, and if they're not, then I probably wouldn't choose to treat them at the consultation. I would make the decision there and then.
I think that's a really good point. I think anyone that, you know, when you've got something that you're so upset about and then you see it go worse, as you say, that's the last thing you want. But if you explain in the consultation that there's a good chance that could happen, then they're expecting it, and then hopefully that client won't be quite as sort of upset. And it's just about managing them and managing their emotions, you know, which we do have to do, don't we, to an extent. I just spotted a couple of other ones. So somebody's asking, does the peel need neutralizing? Yeah, absolutely it does. So we just neutralize it with water. So you might want to use, like we use disposable sponges. Some people I know use gauze, some people use mittens, you know, whatever your methodology is, but we just use cool water and we go over it several times. It's really, really important that you make sure your peel is fully neutralized. If it's not, that is when you can get reactions. So we would go over it 2 to 3 times, and then we also actually do another cleanse afterwards. This is in the full protocol. So we would cleanse just to make sure that peel is neutralized, particularly if we're about to put IPL on. That is really, really important.
I'm just going to go back. Sorry, I just realised that at the bottom of the last person who said that they were really worried about treating, they only do, not only, because obviously it's a good treatment, but they do Dermalux and products and peels. Yeah, so I would say, if, you know, when I was saying giving you confidence to treat, yes, Dermalux is brilliant for a lot of things. Personally, there is, hands down, there is nothing better than the 585 handpiece on the Lumina, and that's where I get my best results. So
yeah. Someone I just spotted that message that you read out, Kerry. I noticed she's just touched on advanced nutrition products. I know I've taken Skin Acumax, which is by this company, and I have to say that it really did help to calm my acne down at the time I was taking them. I can't remember what's in them, to be totally honest, but you know, certainly the right sort of you know, vitamins can really help, and equally the wrong sort. So I know I was taking for a short while Acnes castus, and it's essentially to help sort of like balance out your hormones and other things that I was dealing with at the time. But it made my skin an awful lot worse, you know. So just be careful what you are taking, but they do get a really good sort of write-up, and as I say, I personally had good results with those. A couple of last questions and then we'll finish up, because I'm just conscious that we could probably talk all afternoon, couldn't we, Kerry?
Yeah, and we do generally when we get together, don't we?
I was warned before I started this webinar, try and keep it to an hour. We'll try. this is a good question. What do you use after eye pin laser to cool the skin down and take the heat out? What do you tend to use, Kerry?
Well, I have a cryo, which obviously when we open up again, we're not going to be able to use post-COVID, but I have a cryo. But it's important to remember not to overcool the skin, because obviously, you know, although the light essentially is killing the bacteria, not necessarily the heat is going to be stimulating, you know, the skin and inducing collagenesis. So you don't want to overcool. But obviously, again, it depends on your skin type. But I use a cryo, which is, you know, when I first had my clinic in 2005, I operated for 3 years without a cryo. When you get a cryo, it's kind of like, you wouldn't want to be without one, but I just used cool packs for 3 years and it was absolutely fine. You know, never had any issues. But once you have one, you kind of don't want to be without one. So I think post-COVID, it's definitely something that I would invest in if you don't have one. And if you do something like fractional skin resurfacing, you absolutely need to have one, because the heat is just, you know, really intense.
I mean, they're saying at the moment, aren't they, in the guidelines, that when we go back, unfortunately, we won't, well, it's not we won't be able to, but we're advising not to use these cryo systems to start with, just because obviously it's blowing the air around and it could, you know, blow sort of matter around that we don't want to be breathing in. So I know when we reopen our clinic, we are not going to be using cryo, which is a great shame. I'm with Kerry, we love ours, but we've got to also put safety first. So just using some nice cold flannels. You can get like the sports sort of gel packs, the ones that you can heat up in the microwave or put them in a cold place. You just want to make sure that they're not frozen, because that's actually too cold. So make sure they're sort of a bit pliable, but they feel cold to touch. So so something like that, really. I mean, if you're going to use something like you know, mitts or flannels or anything like that, you've got to make sure that you keep resaturating them in cold water. And again, at a time like this, that might not be an ideal solution. Sports gel packs at the moment are probably the best option, because you can sterilise them, and also you can wrap them in cling film. So we'll wrap ours in cling film, take that off, and then give them another final clean as well. Tend to find with these treatments, you don't actually need to do too much post-cooling. You know, the IPL for acne, you don't actually put that much heat in, do you? So you tend to find you don't need to do too much. So just to finish up, there's loads of questions. I've tried to pick out the main ones. If anyone's got any specific questions that they feel like I've not answered, just send us an email to the clinical account and I'll answer them for you. So it's clinical@lynton.co.uk, and I'll just see if I can answer a few more of those for you. But we will send the slides out, and also there will be a copy of the webinar available for you if you want to rewatch it again. So thank you for your time, Kerry.
That's okay. And very lastly, anyone who is feeling a little bit nervous about treating acne, I'm so confident treating acne with the Lumina that I've actually launched a competition this month to treat someone and actually follow their progress in real time on social media. And I wouldn't be doing that if I didn't, you know, feel confident that the before and after photos are going to look great.
Yeah, that's a really good point. Yeah, well, that's a really good point you've made. And for someone like you who's been using it for years, your input is so valuable, you know, because you've treated enough of these clients to give that genuine, you know, honest feedback. You don't work for us, so you don't have to say what you say. You know, it is your genuine experience of using the equipment.
And I don't get paid to do these webinars either. Just want to clarify that. I just do it because I love, you know, I love talking about laser and laser treatment. So I've just realised, actually, I think my computer's about to conk out because it's not.
Well, there you go. Well, there's a good time to end it then in that case. Oh, all right then. Well, thank you everyone for attending. Sorry about the start. It was terrible with technology, but hopefully we got there in the end. As I say, any more questions, send them on to us, and we'll see you again soon. Thank you for attending.
Thanks,
Take care.